hours until May 15th. Ecuador's health minister confirms more than 22,000 COVID-19 cases. And in Nigeria, Lagos's local government has opened a testing center to ramp up mass testing for COVID-19. Hello and welcome to Telesur English. I am Estefania Bravo in Quito, Ecuador. This is from the south. As of Wednesday, 100% of the people who presented with COVID-19 in St. Lucia have fully recovered. The Caribbean island reported its first imported case on March 13th. By April 10th, the country had 15 confirmed cases. Taken to Twitter, Prime Minister Alain Chastanet said all patients had received negative results with no additional positives recorded. Antigua Barbuda has reduced its curfew hours initially from 7 a.m. to noon to between 6 p.m. and 6 a.m. until May 15th. During the 23 days, construction projects are permitted to recommence and restaurants may open for delivery, drive-through and curbside deliveries only. All social distancing rules and the wearing of masks still hold. Meanwhile, no more than 2 people are authorized to travel together. Thus far, Antigua has 24 coronavirus cases, 3 deaths and 10 recoveries. In the Dominican Republic, street vendors say they are at the end of their rope and have no way to survive. We have more in this story.
Informal workers are asking help from the government to survive the dramatic economic impact caused by social distancing measures imposed to control the coronavirus pandemic.
We've spent almost 15 days at home. We've spent all of our cash and we have nothing to eat anymore. The government told us to stay at home, but they gave us no aid, no food, nothing. We have started to head outside because nobody's thinking about our survival.
The National Association of Street Vendors has asked that its 2,000 members be included in the government's stay-at-home program. The program is providing aid to 1.5 million families in the form of a monthly subsidy of $95 for 2 months.
Street vendors are going through pure chaos. We have spent an entire month without work, without making a cent. We are part of the informal commerce, and as such, we live on a day-to-day basis. Working today so we can eat tomorrow. Imagine our desperation, to choose to go out on the street because we are receiving no aid.
They are forced to go out on the street and expose themselves to the virus in order to bring food back to their families.
I demand the government help us. We at least need food stamps because I have no way to go on. This is why I'm out on the street. I'd like to be at home instead.
According to the Dominican Republic's central bank, informal workers make up 56% of the nation's workforce.
In Argentina, a second nursing home has been evacuated in Buenos Aires a day after another one was emptied due to residents and staff members testing positive for COVID-19. 9 cases of COVID-19 and 1 death among the residents was confirmed to the relatives late on Tuesday. But relatives say it took nursing home authorities 5 days to inform them about the situation. And until Tuesday, they didn't even know that residents had been isolated in the rooms. These are the first public cases of outbreaks of the new coronavirus in nursing homes in the country. As part of their efforts to contain the COVID-19 outbreak, health authorities in Mexico City have ordered the disinfection of public spaces. Let's have a look.
Cleaning crews move around Mexico City, sanitizing public spaces in hopes of reducing the rate of infection of the novel coronavirus. They use special equipment to protect themselves from the chemical they use to disinfect these spaces.
As citizens, we also need to take precautions. There's been a lot of information shared on how to protect ourselves from the virus.
They work in areas where people still gather, in particular public transport and markets, which remain open. But both customers and merchants are also taking precautions against the virus.
We no longer have direct contact with people, and as such, we try to maintain social distance.
The use of antibacterial gel is one of the most important measures to prevent the spread of COVID-19. Mexico City's government has been producing the required amounts and providing it to metro users.
The process is simple. What's most complicated is knowing how to produce a quality product, in particular, to the amount of ethanol that needs to be used.
To be effective, the gel must contain 70% alcohol. Still, authorities recommend citizens stay at home in order to better fight the pandemic.
South Africa will slowly begin easing a 5-week nationwide coronavirus lockdown starting from next month.
Beyond Thursday, the 30th of April, we should begin a gradual and phased recovery of economic activity. We will implement what we call a risk-adjusted strategy through which we take a deliberate and cautious approach to the easing of current lockdown restrictions.
In Nigeria, Lagos says local government has opened a testing center to ramp up mass testing for COVID-19. With help from the Nigerian Center for Disease Control, state authorities are hoping to detect cases, including among individuals who may be asymptomatic. Any person who may test positive will immediately be brought to an isolation center for treatment. Lagos State on Wednesday reported just over 500 confirmed cases of COVID-19, while there are about 300 confirmed cases elsewhere in the country. Nigeria's death toll stands at 58.
This testing center or sample collection center actually opens up some patients who have the infection and may not know. So immediately we get any positive case, of course, the surveillance team who are involved in contact tracing immediately follows up on the people who have been exposed to such a patient, while the patients are also evacuated to the isolation centers for treatment. So it's a good one for the control of COVID-19 infection.
With well over a third of the world's population under lockdown, education systems across the world have had to adapt to the extreme circumstances. In Ivory Coast, the government has implemented a project called My School at Home, by which students can receive classes from home. The project primarily uses the WhatsApp mobile application and Facebook to provide students with continued education. Authorities say that for the time being, the program is only available to people in the 5th, 9th, and 12th grade, but will soon be expanded.
True that we are in Abidjan, but access to TV is not easy for everyone. Personally, we don't have a TV at home, but with the online courses I can follow the lessons better, and even when you don't understand, you can ask questions to the teacher. You even talk like friends. It's very interesting. He answers you when you don't understand. He makes a voice message or even makes a video to send you, and then it is even more understandable. These are free courses organized by a group of private teachers in the community of Port Bouet and supported by the town councillor Mr. Vande Karamoko. These courses take place on WhatsApp platforms in groups of 50 students.
We'll take a short break now. Join us again in a minute. Welcome back to From the South. More news now. Ecuador's health minister has confirmed more than 22,000 COVID-19 cases. Our correspondent Denise Herrera in Quito has more.
The Ecuadorian health minister, Juan Carlos Ceballos, just confirmed that Ecuador has 22,160 cases of COVID-19 in the country. This figure doubles the current number given by the authorities in the morning. The authorities said that the country has around 11,000 cases of COVID-19. The authorities also confirmed a new donation. The government said that the donation of 2.2 tons of medical supplies from Chinese telecommunications giant Tencent Global will help the government to face this health crisis. Meanwhile, the economic reforms are an important point of discussion in the National Assembly. Most of the Assembly members of Ecuador are rejecting these new economic measures given by the government. They said that these economic reforms set by Moreno are not protecting all the Ecuadorian citizens. However, the way that the government is facing this health crisis have been criticized by different social organizations and citizens who are demanding that all Ecuadorian citizens must know the truth in relation with the COVID-19 situation.
To talk more about the economic impact of COVID-19 in Latin America and the Caribbean, we are joined by Emilio Scottie. He's a lawyer, anthropologist, and a political analyst and joins us from Quito, Ecuador. Thank you so much, Emilio, for being with us.
Hi, Stefania. Greetings from Ecuador to all our viewers. First, I would like to talk a bit about a bad example of how to manage a crisis of this level, and that example is, unfortunately, my country, Ecuador. So, well, even though the virus is going to affect our economy on a global scale, the policies deployed by the Ecuadorian government insist on austerity. That means that 2 law projects were sent by the president to the Congress. One of the projects is meant to reform the national system of public finances and planification. This project basically dismantles the capacities of the government to make monetary injections to the local economy and puts the fiscal balance as its main priority. This is a very serious mistake because Ecuador comes from a previous sustained economic growth process that was led on a planified economy that was organized by the central state. So the central state acted as an agent of redistribution. You take taxes and you assure social services, which means that people have more money in their pockets and can spend more, and that's good for local and small businesses. This is being totally dismantled. So it has shown the first signs of how bad our economic system and how weakened it is, has been shown during the crisis, especially in the public health system. So what happens there is that due to these austerity measures that President Moreno has implemented, with the recommendation of the International Monetary Fund, the reality of our hospitals is that they have been suffering from a reduction in their budget for the last 2 years. So now what's happening is that we have to face the crisis with a public health system that has no doctors, that doesn't have the necessary money and the political overall the political intentions to strengthen it. So then it doesn't come as a surprise how bad the virus has affected Ecuador. And this can be an example for what's necessary to handle this crisis in all the other countries. This isn't an ideological thing as many people would expect. For example, we have the United States. Donald Trump is pretty conscious about luckily he's conscious about what needs to be done in the economic terms to recover from the COVID crisis. And that means an injection of money to the local economy that is led by the government. So the 2 options is what's happening in Ecuador, that is austerity, cutting more the size of the government, firing doctors, reducing the salaries of all the public sector, and also allowing that the private sector can let go of their employees easier. They're not paying the salaries or the compensations that will be normally paid in the circumstances. Or the other option is to go back to a planified economy that from the state injects money to where it needs to be, that is in the pockets of the people, and in granting rights and overall public services such as health and education. As for the repercussions, the consequences in the future are pretty bad. The IMF estimates that the Ecuadorian economy will decrease in a 6.5%. That is is unheard of. It's really high. Ecuador is going to be one of the most affected countries in the whole region. And the measures that are being taken from the government are they're not giving an answer to this reality. So we are really concerned about it.
Now, Emilio, let me just ask you about, let's talk about Latin America. There's a report by the UN, and it says the COVID-19 pandemic will lead to the biggest recession in the region's history. What's your opinion on that?
Well, I agree on that comment, but I think there's going to be substantial difference on how every country in the region handles the crisis. For example, I picture that countries such as Colombia and Peru will devaluate their currency with the expectation to inject some capital in the economy. But, for example, Ecuador, that's not an option for Ecuador because we use US dollars. So taking a measurement of inflating our currency is not an option. That means we have to make sure that the dollars we have circulating in our economy stay inside Ecuador. And that's really complicated when in a global scale market. On the other hand, I do see that some countries are starting to think about the economic future of the crisis. I mean, because shutting down of most of the businesses of a country can destroy a local and global economy. What I think would be really important, thinking in a regional level, would be to have a regional instance that can help us bargain to get cheaper credits and overall could help us cooperate as countries in the same region to get faster out of the crisis. That instance would be UNASUR. That will be the ideal instance. Unfortunately, it's being dismantled. So the reaction is being taken individually from each country in the region. There's not a regional coordination. And overall, there's not a regional vision of how these can turn out for Latin America.
Emilio, we thank you so much for your time for Telesur English, and we hope to be speaking to you very soon.
I hope the same. Thank you, Stefania. Have a good day.
We were speaking with Emilio Scottie in Quito, Ecuador. He's a lawyer and anthropologist and also a political analyst. And that was our previous interview with Emilio Scottie. We spoke about the economic challenges facing Latin America and the Caribbean amid the COVID-19 pandemic. Let's take a short break now. Don't go away. Welcome back to From the South. More news now. France has announced 39 million additional euros for food aid to the most vulnerable who have been hit hard by the consequences of the coronavirus pandemic and containment measures. This adds to an aid package of more than 50 million euros.
I am therefore announcing today an emergency plan to support food aid in France. This plan will be endowed with 39 million euros. This amount is equivalent to 1/3 of the annual budget allocated by the state to associations for food aid. The plan is made up of two pillars. On the one hand, financial support for associations, and on the other, emergency food aid for areas in need.
In Italy, the bodies of 61 unclaimed COVID-19 victims have been buried in one of Milan's main cemetery. City regulations say that the families have 5 days from the time of death to take care of the remains of their loved ones. If nobody claims them, the municipality takes care of the burial. The deceased will have to stay there for 2 years. If in the meantime someone shows up, they will be able to recover their family members after that date and take them elsewhere. Nearly 13,000 people have already died of the virus in Lombardy, whose capital is Milan, and which makes up over half of Italy's death toll. The UK's health minister has announced that testing capacity will be expanded to all essential workers in the fight against the novel coronavirus. 616 people have died on Thursday, taking the country's official death toll to more than 18,000.
As we expanded the capacity from just 2,000 tests a day at the start of March to 10,000 tests a day at the start of this month, so we've been able to further expand access. Today, I can go further. We can make it easier, faster, and simpler for any essential worker in England who needs a test to get a test.
And staying in the UK, a mosque in Birmingham has set up a temporary mortuary for COVID-19 victims in a car park staffed largely by volunteers. The Central Jamia Mosque Gankol Sharif has offered Islamic burial services for the past 2 decades, but the explosion in demand brought about by the coronavirus pandemic has seen it dealing with an average of 5 or 6 funerals per day.
So there's a lot of grief going on because of the social distance and how many people are allowed to attend. 5 to 6 people. Some families have got father who's passed away, who's got 6 sons or 4 daughters, and it's really making it hard for families. And obviously everyone's at home grieving, as other families cannot join in with them. And I think that is a very big hit for families who are sitting at home and grieving.
The border between Hungary and Serbia is being partially reopened despite the ongoing coronavirus pandemic. Workers, including agricultural laborers, will be able to cross the border to work. While Hungary reports only about 2,300 COVID-19 cases, but with a death toll of 239. It has the highest mortality rate in the region. Experts also fear the low number of confirmed cases is due to a lack of mass testing.
The first is that from today, Hungarian and Serbian citizens can again cross the Hungarian and Serbian borders with the aim of working or carrying out agricultural tasks within an area of 50 kilometers from the border.
Bosnia's security minister has proposed the deportation of migrants from the Balkan country, alleging that they pose a potential security threat and a severe economic burden amid the COVID-19 pandemic. He provided no date for when the proposed legislation would be ready for debate in Parliament.
People who do not want to show their identity cards will not be allowed anymore to use our migrant and refugee camps. They will go straight to jail, and we will keep them there for 1 year to 5 years until we can establish their identity. This is our proposal for a new law.
China has announced it will donate another $30 million to the World Health Organization to help in the fight against the coronavirus pandemic. This comes after the U.S. government last week froze its funds to the UN body, accusing the WHO of covering up the seriousness of the COVID-19 outbreak in China before it spread.
China has decided to donate another 30 million in cash to the WHO in addition to the previous donation of 20 million to support the global fight against the COVID-19 and strengthen the health systems of developing countries. Supporting the WHO at this critical time in the global fight against the epidemic is defending the ideals and principles of multilateralism and upholding the status and authority of the United Nations. The virus is the common enemy of mankind, and the international community can only win the war if it works together. China's contribution to the WHO reflects the support and trust of the Chinese government and people for the WHO, as well as its contribution to the cause of world public health and the global fight against the epidemic.
China has tightened restriction on movement in the country's northeast and near the Russian border after a recent surge in imported coronavirus cases. The region has seen an influx of imported cases, mostly among Chinese citizens returning home from Russia. In the city of Harbin, where 2 new coronavirus clusters have been linked to local hospitals, people and vehicles from outside the city are banned from entering residential zones. As of Wednesday, there were 537 confirmed domestic coronavirus cases and another 384 imported cases in one of the region's provinces. And with that, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And be sure to follow us on social media as well. We are on Facebook, on Twitter, and on Instagram. And be sure to follow me on Twitter at @BravoTelesur. For Telesur English, I am Estefania Bravo. Until next time.